So we're going to take up the subject of inflammation and the pathophysiology of fever. Right? We've all had a fever. Right? That's when our body temperature becomes higher than normal, right? What's going on? How did that happen? Well, we're going to use our paradigm of this homeostatic control mechanism and negative feedback response to understand how fever works. Before we get to fever, though, let's talk a little bit in broader terms about inflammation. The purpose of inflammation is that injured cells, cells that have been injured, and white blood cells start to release chemicals. And these chemicals cause what's known as inflammation. This is called the inflammatory response. Now, who are these chemicals? There are a whole bunch of them. These are just some of them. Histamine, kinins, leukotrienes, prostaglandins, interleukins. Every month they discover new chemicals. All of these chemicals create what's called inflammation, or the nonspecific immune response. But before I review what these chemicals are doing, let's come back here. What did we say? What causes cells to release these chemicals? So what causes cells to release these chemicals is injury. Let's talk about what would injure our cells. One thing that would injure cells is, number one, a microbial infection. This is what you had learned about in microbial infections. So you learned about bacterial infections, right? How do bacteria harm us? We've talked about it before.
By eating them.
By eating you. They are living things. They're inside your body. They need food, right? Do you need food to live? Yes, you do. Does your dog need food to live? Yes, it does. If bacteria are alive, they need food to live. If they're in your body, what are they going to use for food? You. They're eating you. All right? So they're parasites. Same thing with fungi. So if you have a fungal infection, an example of a very simple fungal infection is athlete's foot. What's it? This fungus is growing between your toes. What's it eating? It's eating your skin, right? It's eating the skin. All your skin is being eaten up, and it's all turning all red. All right? These are living things. Now, something that's not alive, but nevertheless injures cells, are viruses. The majority of viruses, and this is not a course in micro, so I'm not going to explain what a virus is, but the majority of virus is not a cell, it's not a living thing, but the majority of viruses, when they enter a cell, cause lysis. What's lysis mean? To break apart. Break apart. Lysis means to break apart. Because these viruses, when they enter a cell, causes the cell to break apart, most viruses are known as lytic viruses. Lytic meaning lysis. They cause the cells to break apart. You learned in a bio class or a micro class that there are some viruses that don't cause lysis. We're not talking about them right now, but those are known as non-lytic or lysogenic viruses. Is HIV a lytic virus? Yes, it is. Anybody remember which cells it specifically ruptures and breaks apart? Yeah, CD4 cells or T4 cells. All right, so we know exactly viruses, lytic viruses are usually specific as far as which cells they enter and which cells they rupture. So there's different viruses that enter skin cells and rupture them. There are different viruses that enter liver cells and rupture them. So that's we categorize all these different viruses based upon the cells they enter. All right, so obviously injuring cells by microbial infections. What else would injure cells? Physical trauma. What's trauma? Trauma means injury. All right? So when you cut yourself, did you cut and injure and kill cells? Yeah. If you touched a hot frying pan and you burned yourself, right? The whole thing turned all red and it's blistering. Did you injure and kill cells? Yeah. How about radiation? You'd say, well, I don't spend too much time at a nuclear generating plant. All right. Well, I think an easy example of radiation is ultraviolet rays from the sun. In other words, we've all had sunburns. All right, that's radiation. Another thing that can injure and kill cells is ischemia. What's ischemia? What is it?
Something with tissue, but
Lack of oxygen. Insufficient oxygenated blood. So when a cell isn't getting enough oxygen, it becomes ischemic. right? You've heard the term myocardio-ischemia. So ischemia is not getting enough oxygen. Well, why would that harm a cell? Why? So it's not getting enough oxygen, so what? Why does the cell need oxygen? Cellular respiration. Oxygen acts as a hydrogen acceptor to accept the hydrogens from the sugar molecules that are being broken apart. Without oxygen, the cells can only generate a small amount of ATP anaerobically by glycolysis, and that's not enough to keep it alive. All of these things injure and kill cells. And when cells are injured, what do? They release these chemicals. Now, there's a third thing that can cause cells to release these chemicals, but in this third case, the cells are not truly being injured. In this third case, this is when people who are hypersensitive are exposed to allergens. So it has to do with people who are hypersensitive to allergens. Now, what is an allergen? An allergen I've defined as an innocuous foreign agent. An innocuous foreign agent. You'd say, what does the word innocuous mean? It means harmless. So what's a foreign agent that's harmless? Is a virus a harmless foreign agent? No. It's a foreign agent, but it's not harmless. So I wouldn't call a virus an allergen. What I would call an allergen is pollen from a plant. All right? Now, pollen is simply the way plants reproduce. You know what pollen really is? It's like a sperm floating in the air. It's a microgamete. Okay? It's like sperm floating in the air. All right? It's an interesting way to view it, but that's what it is. So we know that there's always pollen around. Certain times of the year, flowering plants release even more. For most people, it has no effect. They inhale the pollen, they exhale, it doesn't matter, it doesn't affect them. But for some people who are hypersensitive to the pollen, when they inhale it, their cells of their body start releasing these same chemicals, the same chemicals that their cells release when they're invaded by a virus or a bacteria. What's another example of an allergen? Some people are hypersensitive to foods. So wheat, eggs, strawberries, peanuts. Is there anything wrong with these foods? No. But if you're hypersensitive, then your body reacts to it as if it were harmful. And here's one of the weirdest. I mean, food is pretty weird. Some people are allergic, hypersensitive to penicillin. Anybody allergic to penicillin?
My husband.
All right. Is there anything wrong with penicillin? For the rest of us, when we're sick, we get penicillin. But not if you're hypersensitive to it, they're not going to give penicillin to you. Because your body will react to it as if you had been exposed to something terrible. So in this case, this third case, it's not that the cells have really been injured, but they react to these harmless foreign agents as if they had been injured. Yep.
If allergens are harmless, how come people have like going through shock and
No, that's the body's reaction to it. If you're hypersensitive, we don't give that to you.
But what if somebody who didn't know they were allergic to a food actually?
Okay, usually what happens, the first time you're exposed, you get a reaction, but it's not usually a fatal one the first time.
Okay.
That's the warning to you that they're not going to, you shouldn't do it again. Because the second time it may be fatal. So that's how people knew you were allergic to penicillin, because a long time ago when you were a kid, they gave it to you and you had an allergic reaction to it.
Did you test cells? Yeah.
They can, but they don't usually routinely. They usually try it and then see what happens.
I actually got some from a dentist who prescribed some to me about 3 or 4 years ago. And I took it, and it's about 2 or 3 hours later, I was
You broke out in a rash.
all over.
It's
Yeah.
probably
High.
codeine.
So I took some Benadryl and about
That's what you do,
7 hours later, it was
Right.
all gone.
right? You just know you're not going to take it again. All right? So, because the next time it could be anaphylactic shock. So, all right. Now these chemicals are released, and most of us have not heard of histamine, but you've heard of medicines called antihistamines. But there are a whole bunch of these chemicals, including prostaglandins, which we've spoken about back in section A. Now these chemical mediators of inflammation, as they are collectively called, primarily produced their effects in the localized area right where they were released. However, two of these chemicals, leukocytic pyrogen, which is also known as interleukin-1. This is actually a chemical produced by white blood cells. Interleukin-1, and those of you who've had micro know there's a whole bunch of chemicals released by white blood cells known as interleukins. Leukin as in white blood cell. What's the clinical name for a white blood cell? A leukocyte. It's also known as leukocytic pyrogen. That can cause a fever, and also prostaglandins. These two chemicals can be carried in your bloodstream up to your brain, where they can affect the neurons in the Thermoregulatory Reflex Center, causing a fever. We're going to talk about that. But before we talk more about fever, again, let's just generally talk about the inflammatory response, also known as the nonspecific immune response. The purpose of inflammation, the purpose of what these chemicals are causing to happen, is to isolate and destroy the noxious agents. Noxious means harmful. So the purpose is to isolate and destroy the bad guys, the viruses, the bacteria, and to prepare the tissues for healing, to promote or facilitate healing. So it's two steps. We want to destroy the bad guys, the pathogens, and we want to promote healing of the injured cells. That's what this response is about. Now, some of these chemicals that are released cause the local blood vessels, right where the injury was, they cause those vessels to dilate. Now, some of you are thinking, oh, cutaneous vasodilation, we talked about that. I'm not talking about blood vessels in the skin right now. I'm talking about these chemicals cause the blood vessels where the injury occurred to dilate. Now, obviously, if the injury is in your skin, then the cutaneous vessels would dilate. But what we're talking about now is some of these chemicals cause the vessels in the injured area to dilate. Now, the question is, what does that do? So what if they dilate? How does that help us? All right, let's think about it. First of all, if the vessels dilate, that increases the flow of blood. That's going to increase the flow of blood to that injured area. Isn't that going to bring more white blood cells and antibodies to that injured area? We said this response is to get rid of the bad guys and promote healing. So by increasing the flow of blood, it increases the delivery of white blood cells and antibodies to the injured area in case there's bacteria or viruses causing the injury. Furthermore, the increase in flow of blood brings more oxygen and nutrients to promote healing, to facilitate healing. Now, because the vessels do dilate, there's this increased flow of all this warm red blood to this injured area, so the area gets all warm and red. And the term for getting all red is erythema. Let me give you an example of what I'm talking about. You're hammering a nail, right? Hammering the nail. And the hammer misses the nail and slams right into your thumb. Have you injured your thumb?
Yes.
All right? Within a matter of moments, those injured cells start releasing these chemical mediators. And some of them cause the vessels in your injured thumb to dilate, increasing the flow of all this warm red blood into this injured thumb. And within a matter of moments, your thumb turns all red and feels all warm. Okay, that's the inflammatory response. Now, it's going to help if there was any infection. In this case, there is no infection, but it would be bringing more white blood cells, and it's going to bring more nutrients and oxygen to promote healing because you've injured those cells. What else do these chemicals do? On page C19, some of these chemicals cause these vessels in the injured area to become more leaky, more permeable. They increase capillary permeability. You'd say, well, like, what does that mean? That means they make the walls of these blood vessels, especially the capillaries, more leaky or permeable than normal. Now, normally, capillaries, of course, have a very thin wall. Those are the smallest blood vessels. You might remember from anatomy, the wall of a capillary is simple squamous epithelium. It's just one cell layer thick. So most chemicals can easily go in and out of cross capillary walls all the time. Oxygen can go across a capillary wall. CO2 can go across a capillary wall all the time. So can sugar, so can amino acids. But there's one major chemical circulating in the bloodstream that normally is too large to go across the wall of the blood vessel. Proteins. Proteins are way too big. Are there proteins circulating in the bloodstream? Yeah, they're called plasma proteins. So proteins normally that are in our bloodstream can't get out. These chemicals make the wall of the vessel more leaky, allowing these circulating proteins in the bloodstream to start to go out of the bloodstream into the injured tissue. Some of these proteins might include antibody proteins, because even antibody proteins circulating in our bloodstream wouldn't be able to get out of the bloodstream to the injured area normally unless a chemical makes the walls of the capillary more permeable. But as the proteins leak out of the vessel into the injured tissue, they osmotically draw water with them. They osmotically draw water out of the bloodstream. You'd say, what? As the proteins represented by my green dots go out, they osmotically pull water with them.
You'd say, I don't get that.
Do you remember we learned when we reviewed osmosis that water follows solute? When you pour salt on a snail, didn't we say that in a sense, the salt surrounding the snail, in a sense, is drawing the water right out of the cells of the snail? So in this case, it's not salt, but protein. As the protein is moving from out of the vessel to outside the vessel, it's osmotically pulling or drawing the water with it. As the proteins leak out, water follows, causing localized swelling or localized edema. That's another characteristic of inflammation.
You'd say, I don't get it.
Let's go back to me hammering my nail. So I'm hammering the nail, the hammer misses the nail, slams into my thumb. Have I injured it? Right, I've injured my thumb. Injured cells start releasing certain chemicals that make the walls of the blood vessels more leaky. Proteins start leaking out of the bloodstream, and they osmotically draw water with them, and it starts, my whole thumb swells up. My thumb gets red because of vasodilation, and it gets all swollen because of increased capillary permeability. These are characteristics that it's inflamed. It's red, it's warm, it's swollen. Now, what else do some of these chemicals do? Well, specifically, and I do want you to know these, prostaglandins and kinins specifically are chemicals released from injured cells that activate local pain fibers. And by activating the pain fibers, you feel pain. Again, you were hammering, that hammer slammed into your thumb, you've injured cells release prostaglandins and kinins that activate the pain fibers in your thumb. So, your thumb now is turned red, it feels warm, it's all swollen, and it hurts like hell. So, now the question is, so far we've been talking about the benefit of each of these. What was the benefit of dilating vessels in the injured area? Brings more oxygen, nutrients, white blood cells. What's the benefit of making the wall of the capillary more permeable? Proteins, including antibody proteins, can get out to the injured area. All right, what's the purpose, the benefit of pain? Did it have any benefit? Huh? It lets you know. It warns you there's something wrong. That's the purpose of pain. You'd say, really? Well, let's say you were walking barefoot. You're walking barefoot and you step on a piece of glass. Because it hurts, you stop and pull the glass out of your foot. If it didn't hurt, you just keep walking and pushing that piece of glass deeper and deeper into your foot. Would anybody, if your tooth didn't hurt, would you go to the dentist? Most people, the only time they go to the dentist is when their tooth hurts. I understand, we go to get the dental hygienist to get them clean. But the only time we ever go with the dentist is when we're in pain. Because that tells us there's something wrong. But otherwise we wouldn't go to a dentist. If it didn't hurt, the tooth would just fall out, it would rot. Because we'd never go to the dentist. So that's the role of pain. Now, some of these chemicals attract white blood cells to the injured area and activate them to start phagocytizing or swallowing up. They phagocytize not only the bad guys, the bacteria or viruses, they also phagocytize the dead human cells to clean up the area to promote healing. Now, what is that term we use of chemicals that attract white blood cells? Chemotaxis. Did we use that term before? Yes, we did, in section B. So when we talked about linker proteins and so on. Chemochemicals causing taxis, movement, is what it means. You learn that in micro. And the white blood cells that are most important in swallowing up or phagocytizing bad guys and dead human cells are the neutrophils, commonly also known as the small phagocytes, and the monocytes, known as the macrophages, or big phagocytes. All right, now, there's another thing. Some of these chemicals cause fever, and that's really how we got into this subject. But before we look at that, let's summarize what we've talked about so far by looking at the previous page, C18. So here's the previous page, C18. So what does it show? Injurious agents.
You'd say, what's that?
Anything that injures your body, causes cells to be damaged. Injured or damaged cells release chemicals. They release kinins and histamines, prostaglandins, interleukins, leukotrienes, all these various chemicals that are collectively called chemical mediators of inflammation. These chemicals cause the inflammatory response. This inflammatory response includes, we'll start here, some of these chemicals attract white blood cells and cause them to start swallowing up not only the damaged dead tissue cells, but also the pathogens, the bacteria or viruses in the injured area. Some of these chemicals cause the capillaries to become more leaky, more permeable, allowing antibodies and other proteins to enter the injured area, but it does lead to edema. It does lead to swelling. That's characteristic because of the proteins leaking out of the bloodstream. Some of these chemicals activate pain fibers, which serves as a warning to us. Some of these chemicals dilate blood vessels, and by dilating the blood vessels, that increases the flow of blood into the injured area, causing the area to turn all red, feel all warm. But the purpose of it, the benefit of it, is to bring more nutrients and oxygen to the injured area, as well as bringing more white blood cells. And some of these chemicals that we're going to see cause fever. The main point that I'm trying to drive home right now is that when cells are injured, they release these chemicals, and these chemicals help make you better. The purpose of inflammation is to promote healing. Don't think that inflammation is in itself bad. It is part of, to use the title of the book written by Walter Cannon in 1929, it is the wisdom of the body. This is what our body does to stay alive, to get better. This is how our body works, to heal. Which obviously what I'm leading up to is that fever must similarly have a healing benefit. That's really what I'm leading up to. All right, most people only hear fever and they think bad. But that's not really the wisdom of the body. The wisdom of the body is it's what brings on the fever, as we're going to see. On C19. So we wrote that there are two chemicals, interleukin-1, also known as leukocytic pyrogen, and prostaglandins that are released from injured cells. And they are carried in the bloodstream up to the Thermoregulatory Reflex Center. So you've got injury to your body. Maybe it's a viral infection, a bacterial infection, a sunburn, these injured cells start releasing chemicals. And these particular two are carried in the bloodstream up to the thermostat of the brain. And they raise the thermostatic set point. Raising the thermostatic set point causes the control center to activate the heat-generating mechanisms. It makes sense. You'd say it does? Yeah, here's what I want you to do when you get home. I want you to go to the thermostat in your house, which I assume is set for around 70, 72 degrees, and I want you to raise it. Raise it up to 103 degrees. If you raise the thermostat to 90 degrees, 100, what do you think is going to happen? What's going to happen? Huh? It's going to turn the heater on. If you don't believe me, I want you to try it. It's going to turn the heater on. And the heater will stay on until the temperature of the house rises to the new set point, however high you set it. So what we're saying is these chemicals raise the thermostatic set point in your brain. So now your brain wants the temperature of your body not to be the usual 98.6. It wants it to be 100.5, 101, 103. That's how this works. And how it's the temperature control center is going to get your body temperature, actual temperature, up to that higher level is the same mechanisms that it activates whenever your body temperature is lower than the set point. You'll feel cold, the blood vessels in your skin will constrict to reduce radiative heat loss, and you'll start shivering. That's always what happens when your body temperature is lower than the set point. So that's what we saw here, is that the constriction of the vessels in the skin, reducing radiative heat loss, and the shivering all generate heat. And now your body temperature is as high, becomes as high as the set point. What we're actually saying is this. Contrary to what most people think that because they have a fever, they're shivering. It's actually the reverse. The more you shiver, the more it raises your body temperature higher and higher. Because muscular activity generates heat. That's what's raising your temperature. If you stop shivering, your body temperature won't go up. Your thermostat's already high, but your actual temperature goes up only because of your shivering. Now, if you've got a bacterial infection, we can help you because we have drugs called antibiotics. Antibiotics kill bacteria, like penicillin, erythromycin. Unfortunately, if you have a viral infection, we don't really have effective drugs. So it's up to your immune system. It's up to your own body. We don't have anything. If you've got viral pneumonia, you don't get penicillin. Penicillin doesn't work against the virus. So it's up to your body. So whatever drugs we've got, we still don't have anything to really help you. It's still up to the wisdom of your own body to fight this. So let's say you've got this viral infection. You're running a fever, you're sick, you have viral pneumonia. There's nothing we can give you. Doctor says, get plenty of rest, drink a lot of fluids. There's only going to be two consequences. Either the virus kills you, or you destroy the virus. There's only two options. If the virus kills you, you die running a fever, and the story is over. You die from viral pneumonia. Do people die from viral pneumonia? Yes, they do. Let's assume it's a happier ending. All right? So what's going to happen is your immune system is going to destroy that virus that's been injuring your body. And as your immune system destroys that virus with all these different white blood cells and all these different chemicals that are produced and antibodies and interferon and all these various things you learn about in micro. So finally your body starts to get better and the cells start healing. As the cells heal, they stop releasing these interleukin-1 and prostaglandins. Now it was these chemicals that raise the thermostatic set point. When the cells start to heal, they stop releasing those chemicals. So now the thermostatic set point drops back down to the normal level. And now we've got the interesting phenomenon where your actual body temperature is 103, and your set points drop back down to normal. So now what does your temperature control center got to do? It's got to cool you down. So what does our body do to cool down? Let's go back to page C16. We already told you what it does. On C16, whenever your body temperature is higher than the set point, first you'll feel hot, Secondly, the blood vessels in your skin are going to dilate to increase radiative heat loss, and you're going to break into a heavy sweat. Can you remember ever having a time where you ran a high fever, and then you broke into a really heavy sweat? So you sweated so profusely you soaked your sheets. That's breaking the fever. Because we know sweating cools you down. It was the shivering that raised your temperature up. It was the sweating that broke the fever, that brought it down. That's what this graph shows right here on C20. So the sweating, the vasodilation, you feel hot, you throw the blanket off you, you break into a heavy sweat, now that cools you down. Okay? And you did it yourself. We didn't have any medicines to help you in the case of a viral infection. So this wisdom of the body, there still must be something to it. We welcome any antiviral drugs because some people do die from the virus. But obviously, reasonably healthy people who get viral infections, their immune system is strong enough to destroy the virus, and they defeat the virus doesn't defeat them. The people who die from viral infections are usually elderly or immunocompromised. Their immune system is not strong enough to overcome the virus. All right, so let's summarize how the fever broke on page C21. So the healing cells stop releasing the chemicals, the thermostatic set point drops back down to normal, and the temperature control center activates the cooling mechanisms. The bottom line point of what we've been learning about so far today is first we talked about on page C14. On C14, this was the temperature control mechanism. Information in, the control center compares the actual temperature of your body with the set point. If it doesn't match, it activates these various effector organs to bring the temperature into line with the set point. What we've also learned today is that these set points can change. So we've learned that chemicals released by injured cells can raise the set point. This phenomenon can happen with other control centers in our body. So there are a whole bunch of different control centers that regulate blood sugar level, that regulate blood pressure, that regulate oxygen levels, and these set points can change. So this model that we're describing is a model that will apply to other things, of how these things can go off. All right, so now, as we wrap this up, let's come back down to C21. We began this before the break. So, is the fever beneficial? We argued that every component of the inflammatory response helps get you better. The vasodilation, the increased capillary permeability, even the pain was to warn you there was something wrong. The chemotaxis of white blood cells and a fever. Again, in a viral infection, you run a fever, the fever is somehow helping because that's what your body wants to have happen. Now, we do recognize, as I said before the break, that we don't want a really high fever because if the fever gets too high, that can start to cause denaturing of proteins, which was the first question we dealt with today, this morning, and the person can lose consciousness, go into a coma and die. So I've somewhat arbitrarily divided fevers into low grade and high grade. And I said a high grade is anything higher than 101, 102, 103. Even that's not too high. It's only when it gets to 105, 107 that we really start to get worried. So then, if somebody's got a high fever, we know we've got to cool them down. They've got to be cooled down. There's no options because the fever itself threatens to kill them. But as adults, most of us don't run high-grade fevers. The most common people who you see with really high fevers of 107 degrees are infants. We rarely see an adult with a really high fever. Most of us, if we get sick, we'll have 101, 100.5, 102 at the most. We don't get these really high fevers. Why not? The whole mechanism of controlling body temperature and the fever is in your brain. Is the brain and nervous system fully developed in an infant? No. And that's why they overshoot. And so even if the fever is beneficial, they overshoot and they can actually get life-threatening, overly high fevers. As an adult, our nervous system is fully mature. And to the extent that this fever seems to be beneficial to us, we don't tend to develop really high, dangerously high fevers. So the mechanism seems to be working pretty well. So what we're advocating is that if somebody's got a low-grade fever, this is the wisdom of the body. So even though it's very common that when people have fevers, they immediately take Tylenol or something to lower it, we're basically saying, if you don't have to take it, you know, this is the way your body gets better. Now you'd say, well then how come all the doctors tell you to take it? Okay, we'll come back to that in a moment. Let's talk about these drugs. So the very first of these drugs, before there was Tylenol, was aspirin. Aspirin is the prototype of all these. Aspirin has been used for over 300 years because it was originally obtained from the bark of a willow tree. Modern Tylenol is totally synthetic, same as ibuprofen, Advil, totally synthetic. Now, if you were to look up aspirin in a drug book, it has many uses, many uses. I've listed 3. It's got more. It's an antipyretic. But what does that mean? Pyro means fire or fever. So it reduces fever. Aspirin is described as an analgesic. Anybody know what algia means, A-L-G? You ever heard of arthralgia? Myalgia? Algia means pain. And when you put the letters A or AN in front of a word, that means to take away. It takes away or reduces pain. It's a pain reliever. And aspirin is an anti-inflammatory drug. It is a classic NSAID. What's that stand for? Non-steroidal anti-inflammatory drug. Did we ever use that term before? Yes, back in section A when we talked about prostaglandins. Now, there are a whole bunch of drugs similar to aspirin. Ibuprofen, which goes under brand names like Advil and Motrin, is almost identical to aspirin. Acetaminophen, which goes under a brand name Tylenol, is similar, but a little bit different. We're not trying to turn this into a pharmacology course, but that's what pharmacology is going to be, is where they get into all these variations of these drugs. So aspirin's used for all these purposes. Now, even though aspirin's been around for 300 years, they only discovered how aspirin and these other drugs work in the 1970s. If you look on the previous page, the bottom, and I don't give history questions, but these are the 3 guys who won the Nobel Prize in 1982 in physiology or medicine for figuring out how aspirin and these other drugs work. That was Sun Bergström and Bengt Samuelsson of Stockholm University, Sweden, and
John Betty Broken Labs, United Kingdom.
okay, these are the 3 guys who shared the Nobel Prize for this. And they found out that the way aspirin works is it blocks the synthesis and release of prostaglandins by injured cells. That's how it works. We wrote that on page C21. So on C21, aspirin, and same with these other drugs, block the synthesis and release of prostaglandins from injured cells. The way they work is they're actually enzyme inhibitors. They actually block an enzyme called cyclooxygenase. I'm not asking you to know that. How would you know that's the name of an enzyme? It ends in ase. So we say aspirin and Motrin and these other drugs are COX inhibitors. COX is an abbreviation for cyclooxygenase. Some of you may have heard of something called a drug called Celebrex. Celebrex is described as a COX2 inhibitor. Has anyone ever seen that? A COX2 inhibitor. It specifically blocks a variation of cyclooxygenase. Celebrex is an NSAID.
Anti-pyretic? Can you explain that one more time? What was
An
it?
anti-inflammatory?
No,
Oh,
no, the first one.
anti-pyretic?
Yeah.
Pyro means fire. Have you ever heard of somebody who's a pyromaniac? That means they like playing with fire. Pyro means fire. In this case, it means fever. A fever is like having a fire in your body. So it reduces fire. It reduces the fever. That's like a fire in your body. All right, so let's make sure you really understand this. Again, in my experience, maybe you do, but sometimes people think they understand it, but they really don't understand it. And how you can help yourself understand is read more. Let's say that you've got a fever, and you take aspirin or Advil or Tylenol. They all stop the release of prostaglandins from injured cells. So you got a fever, you take the Tylenol. Does it totally get rid of your fever? Does it totally bring the temperature of your body back to normal? No. It lowers the fever, but it doesn't bring it to normal. Why not? Because there are two chemicals that raise the thermostatic set point. Prostaglandins and interleukin-1. And these drugs only stop the release of one of those two. Prostaglandin. Interleukin is still being released and still raising that set point. So it lowers the fever, but doesn't stop it. If we had a drug that stopped interleukin-1 from being released, and we took also aspirin or Tylenol to stop prostaglandins, there'd be no fever. Those are the two chemicals that raise the thermostat. So now you understand why it doesn't stop it entirely, only partially. Now, let's ask this question. What if you don't have a fever at all? You've got a normal body temperature, right? You have no injury in your body. You're not producing prostaglandins. You have no fever. So if you take Tylenol right now, what does it do to your body temperature? Absolutely nothing. It doesn't lower it. The Tylenol stops the release of prostaglandin. Aspirin stops the release of prostaglandin. If you're not releasing prostaglandins right now, then it has no effect. It stops them from being released. You weren't releasing it. It doesn't lower your body temperature lower than normal. Try it. Take your temperature, find that it's normal, take a Tylenol, and see if it lowers it any. It doesn't. It will have no effect whatsoever. It's not affecting your brain. It's affecting injured cells. It's stopping injured cells from releasing prostaglandins. Now, this article was written by a dentist, and it gives you an overview of inflammation. But take a look on the page 2. On page 2. And on page 2, there's a chart. So on page 2, there's a chart here on the bottom left, and it indicates the inflammatory response and the participating mediators. One of the components of inflammation is vasodilatation. Vessels dilate. Now, which chemicals released by injured cells cause vessels to dilate? This is a list of them. Prostaglandins, histamine, kinins, serotonin. I'm not asking you to remember it, but we know specifically which chemicals cause this. A second component of the inflammatory response is an increase in vascular permeability. And we know exactly which chemicals cause that. Now, here's why that's useful. If histamines, for example, cause vessels to dilate, and histamines cause vessels to become more permeable, now you can understand what an antihistamine drug does. It prevents those two things from happening. So when somebody has got a cold virus, and the cold virus is injuring cells in their nasal passages, so then their nose, inside of their nose, all red. It's all red. All the vessels are dilated, and the capillaries are made more leaky, and so all this fluid is coming out of the bloodstream, and the nose is running and dripping, and it's dripping with the nose, and they get cold, and so people go with a runny nose, and there's congestion, and they take antihistamines. And the antihistamines will constrict the vessels because it prevents histamine from dilating them, and it will prevent the capillary walls from becoming more leaky and reduce all the swelling in the runny nose. That's how it works. Another component of the inflammatory response is PMN chemotaxis.
You'd say, what's PMN?
Well, that's something that one should have learned in a microbiology class. It stands for polymorphonucleosides. Polymorphonucleosides, PMNs, which is another way of referring to neutrophils. So I had mentioned that there were small phagocytes called neutrophils and large phagocytes called monocytes. Macrophages are monocytes. Okay, so macrophages means a big eater. Those are technically called monocytes. So, so what causes, which chemicals attract the white blood cells, especially neutrophils, to the injured area? Which chemicals activate them to start phagocytizing? These chemicals. But the main components of the inflammatory response, where I want you to know the chemicals, is I want you to know, we know another component of the inflammatory response is pain. It warns us of injury, and I want you to know kinins and prostaglandins cause that. It's already in your notes. We already mentioned it. And the two chemicals that cause fever, that are raising the thermostatic set point, are interleukin-1 and prostaglandins. We've got it in our notes. So you should know that.